General Shinseki, as you know, we often face challenges in treating our veterans who live in many rural and remote areas. This is especially true in places like Alaska and Hawaii, where you just can't get to some places by jumping in a car and driving there. I know that you are working on an MOU with the Indian Health Service to find solutions to help provide services to our Native American veterans. And I commend you and all you're involved in these efforts. Ms. Secretary, can I get your commitment to look into possible ways of working with the Native Hawaiian healthcare systems and the Native American veteran systems to provide services for, in this case, Native Hawaiian veterans who live in many of the rural parts of the state of Hawaii?
Senator, you have my assurance that we will do our utmost to provide for any of our veterans, wherever they live, in the most rural and remote areas, the same access and quality to health care and services as we provide to someone living in a more urban area. There is a challenge with that, but we are not insensitive to that challenge, and we're working hard to provide VA provided services, and where we can't, to make arrangements where, if quality services exist in those areas, making arrangements for veterans to be able to participate in those local opportunities. We are, I think you know, working and have been now for some time on signing an MOU with the Indian Health Service, so that wherever they have facilities and we have vested interest that a veteran, eligible veteran, going to an Indian Health Service facility will be covered by VA's payments. And we're in stages of trying to bring that MOU to conclusion. We intend to do that. And where tribes approach us prior to the signing of that MOU and want to establish from a tribal nation with VA a direct relationship because they have a medical facility and would like us to provide the same coverage, we're willing to do that, but that would be on a case-by-case basis.
Thank you. Secretary Shinseki, staffing shortages continue to be a problem, although there's been progress. With some clinics are seeing staffing levels below 50%, causing excessive waiting times for veterans that need care. I understand that this is an issue you've been working on. As you know, the number of veterans needing services is growing yearly, and it shows that you have been making progress. Can you provide an update on the department's progress to address staffing levels?
Mr. Secretary, thank you. Senator Akaka, thank you for the question. We've addressed we've talked about mental health earlier and the efforts that we're making to try and assess whether there's adequate staffing there. I think you're probably talking about primary care, which is our largest outpatient clinic operation. We treat 4.2 million veterans in our primary care system, and it accounts for the lion's share of our budget expenditures. We assessed staffing 3 years ago when we began to implement what we call the Patient Aligned Care Team, or PAC program, and have done it again recently. And we're finding that we are now able to bring up the support staffing and the physician staffing to reasonable levels associated with the standards around the country. I would like to take off record, offline, any information you have about specific places where there's a 50% vacancy rate. I'm not aware of the fact that we have this around the country, so I would be delighted to meet and talk with your staff and find out where these areas might be so that we can address them specifically.
My time has expired, but Secretary Shinseki, as we face budget constraints, we must all work to improve our efficiencies and redouble efforts to look for ways to get the most for our budgeted resources. My question to you is, can you talk about any steps you are taking to improve the acquisition process at VA and any efficiencies you have been able to realize in this area?
Senator, I would tell you that we have been working for several years now on restructuring our acquisition business practices. 3 years ago, acquisition was spread throughout the organization. Now it's consolidated in 2 centers. One comes directly under Dr. Petzel, and that's for all medical acquisition, gloves, masks, aprons. We ought to be able to leverage that into a bulk purchase and get a good price on those kinds of things. For everything else, we have an Office of Acquisition, Logistics, and Construction, and we have a director who heads that office, and everything else governing acquisition is consolidated under his review. Both offices the work of both offices then come up to my level, to the Deputy Secretary, as part of our monthly oversight review process.